Good morning, Illini. I'm your host, Matt Schrock, here for Healthy Illini Podcast. We're glad you're with us today. We are heading towards the summer months, and with that comes some concerns and some issues, and we're going to talk about those today as we talk about some of the things that you may be facing as the summer activities kick into high gear. I'm joined today by the medical director here at McKinley Health Center, Dr. Robert Woodward. He's been on the program before. Dr. Woodward, thanks for joining us this morning.
Well, thanks for inviting me.
So, like I said, it's a time of year for being outside, and it's a time of year being active, and while there's fun and there's activities that come with that, there's also some concerns, and one of those concerns is seasonal allergies. But, you know, that's a term that kind of gets thrown around a lot, and it's kind of a catch-all for a lot of things, but it actually has a meaning, and it actually has some significance to it. So I want to start off with kind of laying the foundation for what it is, but what is meant by seasonal allergies?
Well, season allergies is also referred to as hay fever or allergic rhinitis, which means like an allergic runny nose. This occurs when the immune system overreacts to pollen or mold or other things in the environment. There are lots of different types of allergies and seasonal allergies. Some of the most common types of allergies are pollen, whether it's weeds, grass, trees, flowers. Mold is another one. Dust mites can also do it. In the spring, you get a lot of tree pollen. In the summer, you get a lot of grass pollen. And in the fall, you come into contact with weed pollen and mold.
So with the different, like the different triggers, are there different symptoms that come from that, or does it tend to be the same kind of reaction based?
Yeah, pretty much the same kind of reactions. These allergies can all lead to sneezing, runny nose, and itchy eyes. You get a little congestion in your sinuses or your ears, maybe some postnasal drip. Sometimes these symptoms can even cause headaches from sinus pressure. Some people really react and get a little bit shortness of breath or wheezing or coughing. The problem with it is all these symptoms also resemble viruses and bacteria, and even chemical exposures can cause some of these similar symptoms.
So is there a way to kind of tell what is and isn't seasonal? I mean, how do you know if the symptoms tend to be the same? How do you address that?
Well, a lot of times it's how long have you had it and when did you get it? If it's cough and cold season in the middle of winter, or if there's an outbreak of flu and or COVID or other things like that, you kind of lean more towards thinking about viruses first, because there's not a lot of things growing in the winter. Also depends on where you're at. Even though you can still encounter tree pollen 100 miles out to sea, usually the location where you're at has specific kind of pollen and molds, etc. in the area. For instance, if you've always been around Champaign-Urbana area all your life and you've never had seasonal allergies before, it's unlikely that you just all of a sudden developed seasonal allergies. It probably is more of a virus or bacteria. However, if you're not from the land of corn and soybeans, you might be first time exposed to it and actually developing symptoms based upon that, because you're from a big city where you're not really exposed to a lot of those things.
That actually leads me to another question I wanted to ask, and it's kind of two parts. So I'm going to present both, and you can answer them however you want. The first is there a typical age where allergies start manifesting? Like, can you be like, you're at a certain age and all of a sudden that's typical people to start developing these allergies? The second thing is, can acclimate to it? Because you said you lived and if you live in an area your whole life, you may not have those allergies. When you go to somewhere new, can you then, if you stay there for a while, can you acclimate to that and kind of have that become where that doesn't affect you as much also?
Well, children between the ages of 3 and 5 can actually start to develop allergies, and then at any point in time in your life you can develop allergies. Surprisingly enough, when I went away to college, and the first time I ever went back home, I found out that I actually had dog allergies. But we had dogs my whole life in my house, and so my normal life was used to being a little congested. And then when I went away and wasn't exposed to that and came back, I realized I had a little bit of dog allergy. But some people might develop cat allergies or other allergies like that. And the same thing can apply to pollen and other allergies. I mean, if your immune system gets suppressed for some reason, you might start developing some allergies. And sometimes it's not on the first exposure either. You might be here as a freshman and not have any problems. Then you come back as a sophomore, and it's the second exposure that actually starts giving you significant enough symptoms that you start to realize it. But a lot of people have real minor symptoms, and they sometimes don't even notice it, and they just tolerate it, and they don't feel like they need to treat it in any way.
So if you do have those symptoms, what are your next steps? I mean, you said, some people don't treat it. Should you go to a provider? Should you go to a convenient care or your primary provider and be tested for allergies? Is it just a matter of just getting some over the counter type of things? Like, what's the next step if you think, okay, I might have some seasonal allergies going on?
Well, the first step really is to do a little tiny experiment on your own. It is very easy to get over-the-counter medicines such as Claritin, Zyrtec, or Allegra, and just take it for 30 days. Get a bottle and take it for 30 days and see if it changes your symptoms. There's also a nose spray out there called Flonase, which is easily found over the counter also. And you can take one or both and just see if they change your symptoms or not. Because a lot of times that's all what people need. I mentioned those three particular products because those do not make you sleepy. The typical medicine used for allergies is Benadryl. If you have a sudden onset of an allergy and it's pretty severe, people run to Benadryl and take a Benadryl, but it can make you sleepy. And in this day and age, we're actually recommending like the Zyrtec, the Claritin, or the Allegra to take instead so that you can monitor your symptoms and make sure you're not getting sleepy, because those don't do that. That's the first step. And then if you have really severe allergies, as in none of that works, or you have lots of lung symptoms, it really is important for you to go see your primary care physician at that point in time. Because there are some people that may be developing asthma, as an example, or maybe getting a secondary infection. A lot of times allergies just clog up your nose, but then viruses can get in there, or bacteria can be stuck behind a clogged nose and start to grow. And at that point in time, it's sometimes worth it. My general rule of thumb is to tell patients, if you've had something for more than 2 weeks, that's probably the time, and over-the-counter medicines don't work, that's probably the time when you need to come in and get checked.
Can any of these allergies develop? I mean, like you said, like, can they develop into asthma, or is it more it's just kind of a trigger that can affect things like asthma and things like that?
A lot of times, people as real small children have something called reactive airway disease, and that's kind of a non-specific term for what could potentially be classified as asthma when you're older. But a lot of people outgrow those kinds of symptoms. But if you have a family history of asthma in your family, you're a little bit predisposed to it, and you never know what might trigger it. For instance, you might be walking in the fall when someone's burning leaves and walk in front of smoke, and then all of a sudden develop an asthma attack. So people truly never get over their asthma. They always have it, but they may not be triggered as easily by it. But then one day something does trigger you.
So going back to you talked about all the types of seasonal allergies and all the triggers that can go there. Aside from the over-the-counter type of treatments and things like that, is there really any kind of, I don't know how to say, other than like lifestyle adjustments you can make? I mean, obviously, if somebody's in the neighborhood's burning leaves and you have that allergy, you want to kind of stay away from that. If it's harvest season, But are there? Do you have any advice? Do you have any tips for as far as mitigating or just trying to be some preventative care aside from the medicines?
Well, you can always move away to 100 miles out to sea and not be exposed to anything, but that's not practical for most people. The one easy thing most people have access to is an air conditioner. Air conditioning filters the air and can make life while you're inside the air conditioning a lot more comfortable for you, and you won't be exposed to the pollen. Some people are sensitive, as I mentioned, to dust mites, and that's very common in any normal household. And people take precautions by covering their pillows and covering their mattresses in specifically allergy protective casings. And that can also help you with your symptoms. And cleaning frequently in a house and not having cloth or carpet around them to gather all these pollens and dust mites and things. and having cleanable surfaces, easily cleanable surfaces like wood or vinyl, etc. And that really helps decrease people that are highly sensitive to allergies. But if you've done all those things and allergies is still a problem, there are some medications that can help you if you have an acute problem that are steroid based. If you also have asthma, there's some medications that can help decrease the different chemicals that create allergy symptoms, not just the ones that the antihistamines like Zyrtec, Allegra, and Claritin do. There's others, for instance, one called Singulair that can help. If you really have horrible allergies and, for instance, something like asthma, there's injectable medications that allergists can prescribe for you in this day and age, but most people don't need that kind of stuff. But at that point in time, they've probably seen an allergist and they probably have had allergy testing. Allergy testing is really only valuable if A, simple methods do not treat your symptoms, which is like over-the-counter medicines, or B, if there is no physical, if there is a physical way to avoid the allergies. So, for instance, one of my sons, we tested for allergies, and he had a peanut allergy. So we can avoid peanuts and exposure to peanuts for him. At the same time, he also had a corn pollen allergy, which you don't really see a lot of that floating around. But we just kind of wrote it off. And then one day his school did a field trip and in the fall around Halloween, and did a corn maze. And he walked through the corn maze, and all of a sudden he's itching and scratching and having hives and everything. And sure enough, that's his corn pollen allergy. So in general, he's not going to be walking through corn mazes too much. So he doesn't really need to be treated for that, but he can avoid that.
So if somebody's listening and they're like, you know what, this sounds like me, I've got these allergies, or they know they have seasonal allergies, but they have questions, and they want to talk to somebody, who's the best person to reach out? Are we talking primary care? Is it pharmacy? What's the best way to go and ask about some of these things?
Well, the first place I would go is to call Dial a Nurse here. They have some easy answers for you. Pharmacists can recommend medicines, but they really aren't going to be able to recommend ways of avoiding the allergens. That's just not in their purview. But if you've tried everything that I've already mentioned and have further questions, then just making an appointment with your primary care physician is a good place to start.
Well, I appreciate you taking the time today to talk about something that I think everybody's heard of, but you may not have as much knowledge of, and so this gives a little bit better background and a little bit better, tools in your tool belt to try and have a great summer, because it is something you deal with. So I appreciate you taking the time and joining us today. Thank you.
Well, thank you very much.
Summer in the Midwest is a lot of fun. There's a lot of activities you can do. It's great to get outside. There's so many options and opportunities. But along with summer in the Midwest often comes seasonal allergies. You have pollen, you have dust, you have harvest type stuff, and it can affect you. And so it's important to know how things affect you. It's important to know what you can do to treat symptoms, what to look out for, and be aware of what's there. And so if you have questions, if you're uncertain, feel free to give us a call. Contact us here at Healthy Illini. If you're a student at the University of Illinois, contact McKinley Health Center. We'd love to have conversations with you and help you figure out the best way to enjoy your time in the summer, the best way to enjoy the activities that you're part of. But thank you for joining us today. You're on a personal journey no matter where you are in it. You are important and you matter. Your health and wellness are important and matter, and we're here to keep you well to excel. So go have a great week, Illini. Let us know how you're doing, and we'll catch you next time on Healthy Illini.